Researchers here in Chicago studying the lasting effects of long COVID have made a significant discovery that could lead to a potential treatment for thousands of patients. Our Suzanne Lemonnier is in the newsroom with more on this promising study at Northwestern Medicine. Suzanne?
Joe, Erica, long COVID impacts about a third of COVID-19 survivors, and those involved in this research are really hoping it's going to lead to a potential treatment down the road to help those with pulmonary issues.
I was coughing like every day for a year.
Long COVID patient Kevin Tenney of Palatine says he was first diagnosed with COVID-19 in January of 2021.
I had trouble sleeping at night.
Tenney took part in a study at the Northwestern Medicine Comprehensive COVID-19 Center.
I remember getting like those CT scans a couple times, and the Dr. Sala would say, I was a little inflamed, some nodules, a thick bronchial wall. I think that's what caused all the coughing, I believe.
It was through lung CT scans like this that Tenney's doctor, Dr. Mark Sala, would learn scar tissue was forming in Tenney's lungs and in the lungs of other study participants. Lab tests showed a certain cell type was the driving force behind the scarring. Sala is the co-director of the Northwestern Medicine Comprehensive COVID-19 Center.
The implication here is that if you can find a drug to target these cells specifically, it might help prevent all of that downstream injury and irreversible scar tissue.
Sala is also the senior author of a paper involving the study of long COVID patients at the center.
This has, over 4 years, resulted in an incredible statement about post-COVID care, as well as many other diseases that involve pulmonary fibrosis, and that cannot be understated. Is that small contribution from each individual to a study like this is extraordinarily helpful for us.
Tenney says news his participation in the study could potentially lead to a treatment for pulmonary conditions means so much to him. He's recovered from COVID 3 times since 2021 and says he's finally feeling better.
Just to be a part of something where we're learning new information that could help people in the future is great.
Dr. Sala says that what is also really surprising is the research showed some participants, even up to a year after their COVID diagnosis, still had the cells present in their lungs responsible for scarring. In the newsroom, Suzanne Lemonnier, CBS News, Chicago.
Suzanne, thanks very much.